Good morning. I am Ngam Young, public health specialist and a public health policy and administration expert and the health program manager at eBase. Today, I will share our work on enhancing evidence-informed decision-making to improve vaccination uptake in Bali Health District, Cameroon, and what this means for building trust and resilience health system. This is the flow of my presentation. I will go through the background, objectives, methods, strategies, results, how we mobilize knowledge, the lessons learned, and the implication moving forward. Although great progress has been made in immunization, rural areas in Africa continue to lack. In fact, about 1 in 5 African children miss life-saving vaccines, which include penta vaccines, polio vaccines, measles vaccine. And this is according to statistics from Gavi, WHO, UNICEF. In Bali Health District, where we conducted this our project, we found a gap in providing caregivers communication, trust, and hesitancy, which directly impacted vaccines uptake. And these challenges that we found motivated us to engage in this project. Our objectives were threefold. First, we had to promote evidence-informed decision-making at both facility and the district level. That's at both at health facility and district levels. We had to strengthen provider caregiver community partnership, and we had to enhance penta vaccine uptake through tailored strategies. As concerning our method, this was a base implementation project, and we applied JBI, PACES, and getting research into practice framework. And the process included a baseline audit. We co-designed interventions with stakeholders and a follow-up audit. We also had participants in this project, included healthcare workers who were the vaccinators, the chief of centers. We also had caregivers who were the mothers who were attending IWC for vaccination. We had community leaders who were sometimes health committee members, who were also focal points of communication, and who were also people who were elected to participate at the level of meetings in the health unit. And we also had district health authorities. And here we had the district medical officers, we had the chief of bureau health, and EPI focal points. We used tools like evidence-based summaries, questionnaires, SMS reminders, and coaching. It should also be noted that in some areas, because some health areas had good network, we use WhatsApp messages that were sent to these mothers. Our strategies were participatory and context-driven. Audit and feedback were provided with providers and the caregivers. We had collaborative reminder system like SMS and home visits. We also did strengthening provider caregiver communication methods, coaching with visual decision aids, most importantly, multi-level engagement to ensure sustainability, because it's a project that we are hoping that if it has to be sustainable, we must involve the local community persons and bring up strategies that are sustainable, realistic. Looking at our results, and if this flowchart shows compliance with best practice. At baseline, you can see the chart, we have the baseline and follow-up. We see that at baseline, performance was very low. Many criteria were below 40%. These criteria that we have, they were taken from evidence summaries from WHO, from Gavi, and documents that support vaccination communication during vaccination. We see that at baseline audit, nearly all the criteria scored below 40%, and also all, some even scored 0. After the intervention, we saw significant gains, with most of the indicators reaching between 70 and 90%. And this shows to us that decision-making improved when it was informed by evidence and shared across stakeholders. So these stakeholders simply need evidence that are decision informed so that they can be able to implement. Looking at outcomes, because our goal was to improve vaccination uptake and reduce zero dose. We see that compliance coverage improved from 65% to 80% of Penta 1, and zero dose dropped from 12% to 3%. It should be noted that according to WHO and Gavi, zero dose should be below 10%, between 5 to 8%. And zero dose are children who have not taken Penta 1 vaccine. That is, vaccines are taken at 6 weeks. So the higher the dropout rate, it shows that many children are not coming in for vaccines. That is why we see that a drop with the zero dose is a gain to us, because more children have come now for vaccination. A key, as concerned knowledge mobilization, a key lesson was the importance of knowledge mobilization. We created inclusive dialogue between providers, caregivers, and leaders. Evidence-informed communication helped overcome hesitancy and the build trust between the health workers and the caregivers, who are the mothers who show up with children for vaccination. We also had, by working together, stakeholders adopted solutions to their needs. And we are seeing that this approach is replicable in other districts across Africa. We will talk about lessons and implications. From this project, 4 key lessons emerge. First, evidence-informed decision-making improves service delivery. When people are informed by evidence, what happens? Service automatically improves. We have already seen this with the improvement in vaccination uptake and the drop in zero dose. Another key lesson and implication is community and the provider partnerships are key to sustainability. And lastly, this approach, with communication, should be treated as a core intervention, and that this approach is scalable across Africa to improve vaccines uptake. In our conclusion, evidence-informed decision-making and stakeholder engagement boosted vaccination uptake in Bali Health District, as we just saw in the presentation. We reduced zero-dose children We also improved coverage in vaccination, that is Penta 1, which is the main indicator for zero dose. And we strengthened community trust. And the next step is to sustain partnership and scale up regionally. We want to thank the healthcare workers in Bali, the caregivers, and the community leaders in Bali Health District, the district authorities, EBS Africa, and our JBI for their technical support and training. Thank you. You can see pictures of our work, and these pictures, you see the stakeholders during the brainstorming station. We also see chief of centers during when we had our after baseline audit. So you can find our work through the QR code. Thank you for your kind attention.